Hello and welcome. My name is Lacey Barrett. I am a student at Clemson University taking scientific communications, and today I will be reviewing how exercise training affects epigenetics and prostate tumors. Now, before we delve a little deeper into the actual research paper itself, I'd like to give you a little bit of a background on exercise and epigenetics and how they both play a role in cancer. So first, using exercise as a preventative and a supplemental treatment, exercise training is shown to be an effective method in cancer prevention and prognosis in general and diseased populations. Additionally, exercise is a safe and helpful activity for most individuals before, during, and after cancer and its treatment. Cancer and cancer treatments are known for their ability to potentially cause harsh side effects such as fatigue, muscle weakness, atrophy, depression, loss of appetite, cognitive decline, and other harsh symptoms that can cause a decline in an individual's quality of life. Using exercise training as a supplementary treatment for cancer patients has produced strong evidence, indicating a potentially effective method of not only reducing the risk of cancer and severeness of symptoms, but also as a promising method of reducing mortality rates and risk of recurrence in certain types of cancers, such as breast, colorectal, and prostate cancers. Now, let's go over the background of epigenetics and how it plays a role in cancer. While the study of genetics is actually focused on the genes themselves, epigenetics focuses on changes that occur during gene expression and how cells affect and control gene activity. So the two most common types of epigenetic modifications include DNA methylation, which involves attaching methyl groups to DNA structures to silence a gene, and histone modification, which involves the addition or the removal of chemical groups to influence how tightly DNA is wrapped around the histones to control whether a gene can be turned off or on. Abnormal epigenetic modifications, which we're going to call epimutations, and the above processes are a common cause of several different types of conditions, which include conditions such as cancers, and then we have genetic, metabolic, and degenerative disorders. These mutations can actually be passed down to offspring produced after said mutation occurs. Human environments and behaviors are the primary causes of epimutations. Examples include sedentary lifestyles, poor diet, drug use, and exposure to environmental chemicals or extreme stressors. And some of these extreme stressors are going to include things like famine, abuse, pandemics, and even slavery. So now let's get into the actual review of the actual research paper, which is called Exercise Training as a Modulator of Epigenetic Events in Prostate Tumors. So first we're going to go over the objectives of this study. So because lifestyle can be highly influential on epigenetics, it's hypothesized that exercise could also influence the epigenome in cancer tissue. The purpose of the study is to observe the effects of exercise training on tumor epigenomes in rats, which had been implanted with the angiotensin type 1, which we're going to call AT1, prostate tumors. AT1 receptors are found in prostate cancer cells and are often elevated, especially in metastatic tumor cells and tissues. To test how exercise training affected the AT1 prostate tumors, both the sedentary control rat group and the rat group exposed to exercise training were subjected to clinical testing in which the microRNA expression, DNA methylation, and histone modification collected from the AT1 tissue were analyzed. Previous studies have been done on how exercise can modulate miRNA expression in breast cancer. This study hopes to be a complement to that study by finding similar actions brought about by exercise in prostate cancer. So now let's get into the results and the discussion, which I've broken up in a couple different slides. We're going to start with exercise was found to alter miRNA expression in AT1 tumors. So the study evaluated if differences in the miRNA expression, which was one of the points of data collected throughout the study, were associated with the anti-cancer effects of exercise. Of the 1,166 rat probes of miRNA tested, none actually passed the filtering false discovery rate, which was set at 5%. However, 75 rats from the ET group showed differently expressed miRNA when compared to the control group. A technical validation using a PCR machine showed an 80.8% increase in MIR 27A 5P which is a type of microRNA expression in the exercise group. Additionally, there was a 41.7% increase in apoptosis in the exercise group, which is a way for the body to eliminate any unneeded or abnormal cells. Cancer has been known to inhibit the process of apoptosis, therefore allowing for uncontrollable cell growth. And if we look at the figure to the right, we can see the 80.8% increase, which is a very significant increase for this factor. So if we look closely, this group that's right here, this is going to be your exercise group. And this group right here, the lighter color, is going to be your control group. Now, these findings complement the previously mentioned study that showed exercise training's ability to modulate miRNA expression, as this exercise training has had a similar effect in rats with PCA, prostate cancer. Future studies would benefit from confirming if this is a result of extracellular trafficking between different tissues. So the second result that was found in this paper was exercise increases global DNA methylation and downregulates DNMT genes in the tumor tissue. The study showed a 58.9% increase in global DNA methylation and a lower DNA methyltransferase, DNMT, expression in PCA tumor in the ET group compared to the control group. So real quick, if we look right over to the right, I'm going to get my pen, and you can see this group right here is going to be our exercise group. We're talking about global DNA methylation. So if we look over here, we have a 58.9% increase in global DNA methylation, which can be seen right here. And this is some pretty significant findings. And then regarding DNMT expression, so this is actually a type of fold change. DNMT1 decreased by 44.38%. 3A decreased by 55.96%, and 3B decreased by around 45%. And these studies, or these findings, complement previous studies that have shown a significant link between exercise and methylation of genes that have been associated with prostate cancer patients. So if we actually look to this figure down here, this is going to be gene expression, and we have DNMT1, 3A, and 3B, and we can actually see these decreases that was mentioned before. So we have DNMT1 decreased by 44.38% right here, and again, these are our exercise groups in the darker colors. And then we have 3A, we have that significant decrease here, and another significant decrease listed here. So now, global DNA hypomethylation and hypermethylation in DNMT3B have been found in malignant PCA tumors. So an increase in global DNA methylation and a decrease in DNMT3B in the tumor may actually help to weaken the tumor and its processes. It should be noted that DNA hypermethylation is typically found in advanced stage PCA cancers. However, hypomethylation has actually been reported in early stage PCA lesions. Since this study was done, new research findings have emerged in recent years. So one of the newest studies on how exercise impacts prostate cancer was released earlier this year by the British Journal of Sports Medicine back in January of 2024, which sought to examine associations between cardiorespiratory fitness changes and prostate cancer risk, occurrence, and mortality. The study found that CRF changes had an inverse relationship with risk and/or incidence of PCA. As CRF increased, the risk and occurrence of PCA decreased by 35%, which is pretty significant. However, no relationship was found between CRF changes and PCA mortality rates. The men chosen for this study's exercise group increased their CRF by 3% or more per year over a period of 3 years. And then in another recent study that was published back in 2023 in the Journal of Clinical Oncology also provided encouraging news about the relationship between exercise and cancer. This study found that cancer patients who regularly exercise reduced their risk of overall mortality of all causes by 25%, which is also pretty significant, along with decreasing the severity of symptoms experienced from cancer treatments. Considering the need for further research on this topic, both studies provide significant findings and evidence on how exercise can positively affect cancer risk and rates. So now let's wrap up this review with future studies and a conclusion on the actual research paper. The potential for novel discoveries is so vast in this field. Because most studies on how exercise affects cancer are relatively new, I believe that some life-changing evidence will emerge in due time, especially considering how exercise physiologists are being more and more supported and referred by doctors in hospital settings. Further research would benefit from being conducted by a research team made up of different specialties, as cancer research has ties with many different areas of expertise. I believe that this research would benefit from long-term studies that included some of the following points. And this includes continuous data collection, such as blood work and biomarkers, how molecular changes in different body systems could affect cancer, how cellular changes affect cancer when both diet and exercise are tested, sex-specific and exercise intensity and/or type differences in how exercise affects cancer. Could genetic modifications using bacterial vectors introduce artificial mechanisms that mimic effects produced by exercise? The results of the study suggest that exercise may have the ability to modulate and potentially normalize abnormalities in global epigenetic modifications that are known to be associated with PCA. This could mean that exercise has the potential to limit or even inhibit cancer growth. Because of these and other similar findings, along with the ability of exercise to reduce cancer treatment symptom severity, oncologists and cancer programs around the world have been implementing exercise programs as a part of their actual treatment plans. This concludes my review. Thank you so much for listening today, and I hope you have a great day. I bid you farewell.